understanding the COVID-19 virus and understanding the COVID-19 vaccines has been the topic of conversation for over a year now. We must continue to educate ourselves to ensure we are getting accurate information to make educated decisions for ourselves and for our loved ones. So many adults have lost their lives to the COVID-19 virus, and there were many children who fell ill to the COVID-19 virus. On December 11, 2020, the U.S. Food and Drug Administration issued the first emergency use authorization, EUA, for the Pfizer COVID-19 vaccine for prevention of COVID-19 for adults. On May 10th, 2021, the vaccine was made available for young adults 16 years of age and younger. On December 18th, 2020, the U.S. Food and Drug Administration issued an emergency use authorization, EUA, for the second vaccine, which was Moderna, for COVID-19 for adults 18 years of age and younger. On February 27, 2021, the U.S. Food and Drug Administration issued an emergency use authorization, EUA, for the third vaccine, which is J&J, for COVID, and that one is for adults 18 years of age and older. On May 10th, 2021, the FDA expanded the emergency use authorization for the Pfizer COVID-19 vaccine to include adolescents 12 through 15 years of age. Many parents and guardians have questions regarding the Pfizer vaccine for adolescents. Joining me today is Dr. Joann Cozza. Dr. Cozza is a pediatrician in Conshohocken, and she has been practicing for over 20 years. It is my hope that Dr. Cozza will shed light on the Pfizer COVID-19 vaccine for adolescents. Welcome to the show, Dr. Cozza. Dr. Cozza, the Pfizer vaccine for adolescents, is it the same vaccine for adults?
Yes, it is. Same exact vaccine.
Okay.
For
now,
12 and up.
12 and up. Okay.
Yeah.
Now, with the Pfizer vaccine, the second dose can produce side effects, I know, in adults. Does it also produce some side effects in children as well?
It can, yes. Yes.
Okay. Okay. Now, the FDA authorized emergency use for the COVID-19 vaccine. Is that the same as FDA approval?
No, it's not. A vaccine that is authorized for emergency use is just that. This particular vaccine is not approved. They still have to approve it by the FDA. It's not approved. It's only for emergency use only. It's not the same thing.
Okay. All right. Now, I do know some people, they do a lot of research, and that's a big factor for them. But it still went through some research with the FDA, correct?
That's correct, yes. But it's
Okay.
They still have to do all of the other studies to get it approved by the FDA. So it's not approved by the FDA, but it's only authorized for emergency use only.
Okay. And
It does not have FDA approval yet.
Okay, but the emergency use is because we've never seen anything like this COVID-19 virus before, and because it was killing so many people, affecting so many people, it was important to get that authorized use.
Correct. Yes.
Okay.
They do some studies, but nothing extent. And when something gets FDA approved, it goes through many steps before it gets approved by the FDA. And they did not go through all the steps they needed to get it FDA approved, but they did whatever studies they needed to do for emergency use. Apparently that's
okay. And
okay.
you know, another question that came up, and I think a lot of people were hesitant, is because they said this came out so quick, but there was already research on COVID-19, correct?
There were research on for mRNA vaccines. They have done research on those type of vaccines before. So it wasn't although we didn't give it out routinely, they have done it on other viruses, other SARS viruses and flu viruses. They have studied mRNA vaccines. We just don't do them routinely for people.
Okay. All right. Now, do you think there will eventually be a vaccine for infants to 14 years of age coming out?
Yeah, yes, there will be some. I think within the next 6 to 12 months, we'll have the vaccine for kids from 6 months to 12, under 12. Right now, it's the kids from 12 and up can get the Pfizer vaccine, and I think Moderna will be available soon also. They just didn't tell us exactly when.
Okay. All right. Now, as you know, Dr. Cozza, children are always touching things and always putting their fingers in their mouths. If my research is correct, the COVID-19 virus is spread from person to person through a cough or a sneeze. Can the COVID-19 virus live on surfaces for a long period of time? And can someone get it that way?
Yes, it can live on surfaces. Is it commonly gotten that way? Absolutely not.
Okay.
I mean, for children, for instance, in daycare, they touch everything. They put everything in their mouth, so they may get it and then bring it home. But they are pretty good at these places at washing surfaces and making sure these kids are playing with their own toys. But, you know, they do the infections, for instance, right now, so we're seeing some of the winter viruses, and they're spreading pretty quickly throughout the schools, and especially the daycares and the grade schools. But yeah, it can live on surfaces, just not that long. I think several days. But the longer it's on that surface, the less of the chance you're going to get it. And I don't know about the infectivity rate probably goes down too, the longer it's sitting out. Okay.
All right. Now, what would you say to those parents who believe in herbal remedies? I really don't believe that they would themselves get vaccinated, let alone get their children vaccinated.
You know, I have no problems with parents wanting to use herbal medicines when their children are sick, as long as they're safe and they're not harmful to their children. But as an alternative to the vaccine, it's probably not a good idea, because it's probably not going to do anything to prevent the infection or the illness if you get exposed to it.
Right. Right.
I mean, in general, children don't get that sick with this at all, which is really nice. We have not seen any of our patients. None of them got admitted to the hospital, and no one has died in our practice.
That's excellent.
Yeah, in fact, the majority of kids I've seen that tested positive had no symptoms whatsoever. They just were asymptomatic carriers.
Wow.
Yeah.
Okay, and that actually leads me to my next question. I was going to say there's so many mistruths about the vaccine and the side effects, and that deterred so many people from getting the vaccine. And I was also going to ask if you've seen a lot of children who had the COVID-19 virus, and was any of them fatal, but you just answered that question.
No. Probably the kids that got the sickest are teenagers. And you know, that's about, they would get bad colds, but most of them recovered pretty quickly within a couple days. I think I had one person that took a couple weeks, but no one got admitted to the hospital that I know of, not in our practice.
That's good. That's good. And my two beautiful grandbabies. So my grandson will be 4, and my granddaughter will be 3 this year. She's 3 going on 33. I love her, just like her, her Mimi. I'm Mimi. I'm not grandma. I'm Mimi. And it scares me because, you know, the daycare was shut down for a long time.
Yes.
Then it reopened, and we're driving their mama crazy. So she's like, "Look, y'all going to school." I'm like, "No, don't send them to daycare, please." So there was a couple of scares where there were some children who had tested positive. They had to shut it down for a couple of weeks.
Okay.
Then there was a daycare worker who had tested positive and they had to shut it down for a couple of weeks. This is so scary, Dr. Cozza. I think
Right.
my grandkids have been tested more than anybody in Philadelphia. You know what I mean? Like when they get that runny nose or when they get that fever, the first thing you think about is, oh my goodness. You know what I mean? It's because on the news, you see COVID, people get sick, ventilator, and unfortunately they pass away. And that's not
Right.
always the case. So it is so scary. So you being a pediatrician, would you recommend parents get their children vaccinated with the COVID-19 vaccine?
Absolutely. We definitely are advocating our patients to be vaccinated. As soon as it becomes available, we're going to make sure our patients are vaccinated. In fact, we have a practice. We only accept patients into the practice who vaccinate their children.
Mm.
We don't accept patients in our practice who don't vaccinate. You really can't have that difference in philosophy in care for your children. I mean, there are people in the practice that may have a medical condition that their specialist doesn't want them to have it, and that's different than a parent not wanting it. So we definitely want our patients to be vaccinated as soon as possible, as soon as it's available. Yes.
Okay. Now, going back when this first hit Philadelphia, and I know you're a pediatrician in Conshohocken and the surrounding areas surrounding Philadelphia, when it first hit, did you see a lot of adolescents, a lot of children that had COVID and you guys did not know what it was? Because I had spoke to some Temple nurses, some Temple doctors, and they said when people were coming in the beginning, they didn't know what it was, and their health would decline so quickly. So in the beginning, did you see a lot of children that were sick?
Let's see, back in like February or March of last year. I mean, we had the typical number of children that had colds, but I don't recall anybody being tested positive or being admitted to the hospital. None whatsoever. We have people that think they had it.
Right.
And we tested their antibodies and most of them tested negative. I even had myself tested, because I usually pick up whatever the kids have.
Yeah.
And I actually had the antibodies done and my antibodies were negative. So it probably wasn't COVID. But in the beginning, when it first hit, and people weren't going out and they were quarantining and staying home and things were shut down, we really weren't seeing any sick kids in the office. We were just mostly doing well visits under 2, so they could get keep up to date with their vaccines. Most of the kids that were sick, we did either Zoom visits or talk to them over the phone. And if they were really that sick, they went to the hospital. But I don't really recall too many people who had to do that.
Okay. Now, what would you say to those parents who are on Google, which I know is not a good thing? Right. My doctor tells me, stay off Google, Melany. You just can't handle it, okay? So those parents who go on Google and read all of those mistruths about the vaccine, what would you say to those parents?
I mean, there's nothing wrong with going on Google. The problem is sometimes the first couple things that you read are usually the hate groups of about vaccinations and about the truths about the diseases. I recommend, first of all, if they're going to read things on Google, they should read things from like the American Academy of Pediatrics, the CDC, even CHOP has great resources and DuPont. They both have really good resources. They should look at the medical literature, and then they should come to their doctor and discuss any questions that they have. People that don't want to get their kids vaccinated or they're scared, if their kids have medical conditions, they should always get approval from their specialist first. I mean, sometimes we don't know ourselves. We have to make sure with whatever the disease the person has, that their specialist says it's okay, that they get it. There are a lot of rare conditions where the kids can't be vaccinated. So,
okay.
But most of the kids are vaccinated that even have underlying health conditions, because you don't want them getting these diseases, because if they get it, they don't do well.
Right. Okay.
They don't
Right.
usually,
the underlying-
they don't usually survive if they have an underlying
Wow.
health condition, like diabetes, like Crohn's disease, like asthma, severe asthma. You have to be really careful. You don't want them getting these respiratory illnesses.
Right. Right. Now, something that boggled my mind, I don't know if you know the answer to this, is that, again, my grandbabies, like they don't require them to wear masks, but they require us to wear masks. What is it about the younger children where the COVID does not affect them, but it affects the adults?
Well, the kids that are wearing masks, you have to be, most places, you're 2 and up, they have to wear masks. You'd be surprised. The 2-year-olds wear the masks, I think, better than the adults do. They keep on. I don't think we know why children have a milder illness than adults. It's not always the case. I mean, there are cases of children who have died from COVID or who have become severely ill. Most of them probably have had underlying health conditions, but not all of them.
Right.
I'm not sure why. I don't know if, I mean, there have been other strains of coronavirus around, I believe, in the past. So maybe they have some type of immunity, cross-reactive immunity from other viruses they get exposed to. I don't know. I mean, you think that I would have gotten it from the kids, but I didn't get it from them either. Neither did any of my associates. Although we wear masks and shields and stuff and gowns when we examine them.
Right. Yeah, you are truly a trooper. I'm going to tell you that right now, Dr. Cozza, because as you know, that I would go to Temple Hospital and I would also go to Einstein Hospital to see the victims affected by crime.
Mm.
But once COVID hit, I said, can y'all send me the referrals by email or, you know what I mean, by text?
Yes.
This really scared me like crazy. And of course, you know, they couldn't have anybody just walking in and out of the hospital. And Dr. Cozza, I'm gonna be honest, when things open back up,
right,
I think I'm gonna still be a little hesitant, you know, and it's just scary. So right. I don't know. Now with the schools opening back up, daycares have opened up a little while ago.
Right.
With the schools opening back up, have you seen an increase in your adolescent patients or children?
In COVID, the younger ones, no, that they're just getting the routine things like RSV and croup viruses and rhinovirus. I have not seen any flu. And the last month or so, I haven't seen any COVID in the office. I've had a couple adolescents that went to urgent care and tested positive. And they were just getting screened for school or for sports, but they weren't sick. I know they said that some of the adolescents have increased. We haven't seen that in the office, not yet.
That's good. That's good. Now, you touched on something. You touched on the flu.
Yes.
So has the flu been kind of non-existent since everybody has been wearing masks?
Yeah, I think so. Yeah,
so was that the answer all along, Dr. Cozza?
We have not seen
around flu season.
We haven't seen one case of flu, not one in the office.
Are you serious?
Not one. And I tested a lot of kids too, and no one, not even anybody that went to urgent care tested positive for flu.
See, I have gone to the hair store in Cheltenham. I have the cutest mask. They match every outfit. I get them. I see where I see these cute masks. I get them. So that's what I'm saying. I will continue to wear my mask for a very long time, even next year, like during flu season. Now, do you think, like with flu season, do you think there'll be a COVID season, like moving forward?
I think so. I believe so. I just don't know. The problem is this virus was around all year long. So I don't know what season it's going to be. I think because coronaviruses can be any season, you're just not going to be sure.
Yeah.
we had outbreaks in the winter and in the summer, so warmer and colder weather.
Right. And
I don't know. I don't know when it's going to be.
Yeah. Now there's new strands out here. Has that hit the United States yet?
I believe so. Yes.
Okay.
We haven't had anybody yet that's had. You mean like the one in England and India?
Mm-hmm.
Yeah, we have not seen it yet, but apparently it's here.
Wow. Wow. So now let's talk about you. And
Okay.
were you afraid when you first, and I don't know whether afraid is the right word, afraid for me, but you're a doctor. So how did the COVID-19 affect you mentally, knowing it was here, it was affecting so many people, and you got up and you went to work every day helping people and trying to make them feel better? How was that for you mentally?
You know, I really wasn't afraid of it. I don't work in the hospital with very sick people, so I didn't really see that part of it. I work with kids in the office, so I'm around sick kids all the time in the office. They constantly come in with fevers and vomiting and colds, so I'm just used to it. I'm used to seeing them and examining them prior to COVID without masks. And I rarely got anything from them. I've been doing this for 30 years. But no, I was not afraid of it. It was hard for me to go to wearing a mask and a shield and gloves and a gown, because I'm not used to examining sick kids that way.
Right.
But you know, do I get sick from the kids? I get an occasional cold from them, but actually I really didn't get much of anything from the kids, which is great, wearing my mask and shield, and which is good because I have asthma. So
oh yeah, so that's good. So
yeah.
okay, now were you hesitant at all about getting the shot? Did your place of business where you work, did they make it mandatory for all of the doctors?
They didn't make it mandatory, but it was strongly suggested. But everybody got vaccinated though.
Okay.
I wasn't afraid.
Okay.
I got the Moderna vaccine. So
okay. All right.
I did get sick. I got sick after the second dose.
Did you?
Mm-hmm.
And why does that happen? Like the first dose, you're okay, you can go on about your business, but the second dose, people are like, "Oh my goodness, it knocked me down. I couldn't do anything."
I'm not sure why. I mean, people got sick after the first dose too.
Okay.
They don't talk about that one.
Okay. All right.
You can get sick after any dose.
Okay. Now, the first shot, how effective is it? Now, say Pfizer and Moderna, they're kind of like equal, right? And then you have the J&J. When you get the first shot of the Pfizer, what percentage is the person protected?
I don't remember exactly. It's much higher than like the flu.
Okay.
I don't remember the exact, but it's probably high up there. It's probably like close to over 90%.
Okay. And
much
then
higher.
The second shot, it
just boosts it. Yes, it's a booster shot.
Oh, okay.
Yep.
All right. And with the booster shot, just like when the children who come into your office and they get their shots, they're I guess yearly shots. Do you think COVID will be like that, like a routine, because there'll be booster shots?
I think there will be, yes. I just don't know. They haven't told us how long the immunity lasts. I don't know if it'll be once a year. It'll be every couple of years. It depends. I guess they have to study people's antibody levels and see how long. If it's like the flu, it'll be once a year.
Once a year. Okay.
Yeah.
Now, I have one more question.
Sure.
I've spoken to parents, and I mean, the COVID vaccine has been the topic of conversation for so long.
Right.
And people are just, again, scared and a little hesitant. So they're saying like, yeah, I got the vaccine, but I'm so scared of the long-term side effects. They think that something's going to happen a year, 2 years, or 3 years down the line.
Yeah, that's a great question. I don't think they should worry about that. I mean, I think if you were to get the infection, especially as a teenager, college student, or adult, you're more likely to have long-term problems if you get the infection than the vaccine. Definitely. I know, for instance, for us, if teenagers, athletes get the infection, they can have heart problems from the infection. So we have to make sure we have to clear them for sports before they go back to sports, because they can get I mean, I know that in the news, you'll hear in the news that one of the vaccine, I think the Pfizer vaccine, has had some myocarditis side effects from the vaccine. It's a small percentage, but it's always been known that viruses, whether it's the flu or whether it's COVID or whether it's rhinovirus or RSV or adenovirus, they always have had a side effect that could cause inflammation of your heart. And you just don't know. Every time you get a cold, you can get an inflammation of your heart. You just don't know you have it unless you're having symptoms. So you definitely want to get the vaccine. I wouldn't worry about the long-term side effects of the vaccine. I'd worry more about the long-term side effects of actually getting the infection. That's more serious and more common.
Right. Okay. Well, thank you so much.
Oh, you're welcome. You're welcome.
On the show. So after this conversation, listen, I won't call you and say, Dr. Cozza, this is my symptom. Don't play with me. Call something into the pharmacy for me. And Dr. Cozza is a wonderful person. I've been knowing Dr. Cozza so my oldest son, Andre, will be 27 this year. And Dr. Cozza was my 2 children's pediatrician. So for over 26 years, Dr. Cozza has been in our lives, and she has been dynamic. She is the best pediatrician that I know. Anytime I call 2 or 3 o'clock in the morning, Melany, it's normal for fever. You don't understand. So, but she is awesome, and I thank you so much, and I thank you for the work that you are doing. You are awesome, Dr.
Well, I've enjoyed taking care of your boys. They're wonderful. Thanks.
Thank you. Thank you for joining me today. If you still have questions about the Pfizer vaccine for adolescents, please speak to your child's pediatrician. I encourage you to get information from reliable sources before making any decisions. It can be difficult to know which sources of information you can trust, especially on the internet and through social media. Before considering vaccine information on the internet, check that the information comes from a credible source and that it is updated daily. I wish nothing but the best for all of you. Peace and blessings.